Are there mutations in T cells in a pre-leukemic stage, and what does it mean?
Yes, so in the pre-leukemic stage, the mutations will be in all cell types and in T cells also. This probably has a meaning because people have demonstrated that if you have mutations in monocytes, that can cause heart disease. So mutations in T cells might be also responsible for other pathologies. This still need to be studied because these mutations go to the entire immune system, and in each cell type it might cause different pathology. So a very important next step is to study what the role of this mutation in each cell type.
Which acute myeloid leukemia can be diagnosed early?
Currently, all the ones that are cytogenetically normal, driven by point mutations, all of them can be diagnosed early. So that's around 80% of the leukemia, of acute myeloid leukemia. But with development of more tools and more parameters that we will measure, like copy number variation, translocations, methylation, proteomics, even cytokines, maybe can predict all leukemia.
Do somatic mutations precede leukemia years before the onset of the disease?
Yes, 30 years before you can find the mutations in the blood. And this is not just specific to the blood. The same is true for probably most cancers. You can find somatic mutations in the skin many years before you develop skin cancer. You can find somatic mutations in the esophagus many years before you develop esophageal cancer. So this is a rule for probably all cancers.
How close are we to early diagnosis of acute myeloid leukemia?
So I think we are very close. We need, as I said, to identify the target population that we want to screen, because screening the entire population is just too much. It's a rare disease. So we need to identify this target population, and once we have this, we can offer early diagnosis to a large proportion of the population.